Good morning. I'm Jeff Jones, the Chief Medical Officer at Cullinan Therapeutics here in Cambridge, Massachusetts. And joining me today is Dr. Ricardo Grieshaber, a clinical systems immunology professor at the University of Erlangen in Germany. And Ricardo, great to have you here with us this morning to talk a little bit more about your experience in clinical research in rheumatic diseases.
Sure, my pleasure to be here. So, rheumatology is a really exciting area of internal medicine. It's an area with a very high unmet medical need. We are often dealing with very complex systemic diseases that are difficult to diagnose, difficult to manage. The patients have a high need for effective therapies to stop progression and organ damage. And so, this is a really exciting area of medicine where also a lot of developments have been made in the past years, both in the research side and then been translated to clinical practice, leading to new therapies.
So, Ricardo, you've shared that B cells are an important part of the pathophysiology of rheumatoid arthritis. And there are approaches targeting B cells that are currently in use for treating rheumatoid arthritis, but there's some investigational approaches for which you've shared data recently. Could you share a little bit more about those approaches to treating rheumatoid arthritis?
There are different approaches to target B cells, and the currently approved way to deplete B cells in rheumatoid arthritis is to use a monoclonal antibody that targets B cells and that uses complement and also cytotoxicity by NK cells and phagocytosis by phagocytes to deplete the B cells. When we look at hemato-oncology, there's different approaches that work really well for B cell driven malignancies. And one exciting approach is to redirect endogenous T cells so that they recognize and deplete the B cells independent of complement and independent of NK cells and independent of phagocytes. And so these T cell engagers, what they do is basically tell the T cell to recognize the B cell and become activated and deplete the B cell in a very effective way. And we have tested this approach in 6 patients with multi-drug resistant rheumatoid arthritis using a CD3 by CD19 T cell engager and had very promising safety and efficacy results.
It's interesting. I mean, part of the reason that we're speaking today is that here at Cullinan Therapeutics, we are interested to develop a novel CD19 T-cell engager, still in investigational medicine, CLN-978, for the treatment of various autoimmune diseases, including rheumatoid arthritis. When we think about our collaboration or other investigations in the future, what do you hope 5, 10 years from now? What would you like the world to look like for a patient with rheumatoid arthritis?
So I think T-cell engagers hold great potential in autoimmune disease. They could really be a more effective way to deplete B cells compared to currently approved therapies. And it's exciting to have the opportunity to move ahead with a collaborative study in a field with high unmet needs such as refractory rheumatoid arthritis. My impression is that we have hit a ceiling right now in terms of the effectiveness and the durability of the response for many drugs that are approved for rheumatoid arthritis. We hope to really break through the ceiling of what current therapeutic approaches can accomplish and to find ways to administer safer drugs, to administer more effective drugs, and to potentially reach a state where the disease can stay in remission for several years or potentially even lifelong without the need to repeatedly administer therapies.
Those are aspirational goals, of course, but as physicians, that's what we always hope to accomplish. And I hope our collaboration helps take us much closer to that goal. Thanks for chatting with us today.
Thanks, my pleasure.